Fall prevention is paramount for seniors, as a simple slip in the home could cause seniors to lose their home as they lose the ability to care for themselves because of injury. But many people don't realize that hearing loss and falls are associated. In other words, one of the many benefits of wearing a hearing aid is to cut the risk of a catastrophic fall. Hi, I'm Jeff Hoyt, Editor-in-Chief of SeniorLiving.Org. In this video, audiologist Ruth Reisman explains what you need to know about loss of hearing and falls. Because I'm in California and she's in New York, I'll be conducting this interview via Zoom. Hi, it's Jeff Hoyt, Editor-in-Chief of SeniorLiving.Org, and today, once again, I have the pleasure of talking to Dr. Ruth Reisman. She is a licensed audiologist in the state of New York, and she's also a hearing aid dispenser. Welcome, Doctor.
Hi, good morning, Jeff. Thank you for having me again.
Glad you're here to impart some knowledge on people. So today I want to talk about seniors and the propensity for falling. Many people know that seniors, it can be a life-changing experience to fall and break a hip, for example. But I don't think people know about the association between hearing loss and falls. So what can you tell us about that?
Yeah, it's actually a very interesting phenomenon that I noticed early on in my career, that there's this correlation between individuals' hearing and how well they're hearing and how well their balance is. So at first I didn't put it two and two together, but then it really does make sense because the hearing and balance systems are so closely related. I was actually invited to a panel of individuals or those that actually oversee the New York City Falls Prevention Program for older individuals. And every individual on the panel said that they had some form of hearing loss and balance issues. So I remember telling the coordinator of this meeting, I think you should have an audiologist on the panel as a professional to address that, correlation between hearing and balance.
And are there any numbers that people have shown in research in terms of you're more likely to fall if your hearing is not optimal?
Actually, the research shows that even if you have what we would consider to be a mild hearing loss, so individuals saying, I can hear, but I have some problems in background noise, etc. Even the mild hearing loss shows that the individual is at a 3 times greater risk for falls. Again, because those hearing and balance mechanisms are so closely related. And then the aging process adds another 2 to 3 times the risk for the patient, because everything just kind of declines and deteriorates with the passing of time, as we would expect.
So you mentioned the mechanisms. Can we get into that a little more? Like, I understand there's an association, but why do researchers think there's an association?
So the inner ear, which is called the cochlea, actually has 2 portions to it. It has the auditory portion and then the vestibular portion, or the balance portion. And there's actually one nerve, which is considered the 8th nerve, or is the 8th nerve, that actually stimulates or innervates both the hearing and the balance portion. It's one nerve that really splits into 2. So if there's damage or deterioration to one aspect, we can hypothesize or deduce that there's going to be a decline or damage to the opposite side. So if a patient is presenting with hearing loss, there's potential that they're going to have a balance issue because the nerve and the organ is so closely related, and vice versa. If someone has a balance issue, we can potentially hypothesize or deduce that they have a hearing concern as well.
What about paying attention? In other words, if I'm straining to listen to you, is it possible I'm not paying attention to where I'm stepping, where I'm going? Is that a potential cause as well?
Yeah, so there's a number of reasons why this may happen. So in addition to the anatomical reason that things are so closely related, there's also the issue of, one, not being able to hear and locate where you are in space. So to make sure that you're sure-footed and that you know where you're going based on your orientation or based on your proprioception of where you are located within space. But there's also this concept in the research that says we have basically a limited pool of resources within our neurological mechanism for for focus and attention, especially as it relates to hearing imbalance. So an individual who has hearing loss, who has to take some of that pool or the majority of the pool to focus on what's being said, there's less resources to focus on their balance and where they're walking and pay attention to those aspects. So that also creates a risk for the patient that if they're using their resources to focus so much on their hearing abilities and their communication, that they could potentially be putting themselves at risk for falls because they're not paying attention or providing enough attention or resources to be making sure that they're stepping in the correct direction and not potentially put on an obstacle or something like that.
So we've talked about the causes, the potential causes of this issue. What can we do about it? Are there potential solutions as well?
The number one solution, and like I said, even anecdotally in the clinic, when we have patients improve their hearing with the use of a hearing device, whether it's a hearing aid that they purchased over the counter, one that they purchased in the office, or if it was like a hearing implant, that's already helping to improve the signal for the patient and improve their hearing, which will ultimately allow them to orient themselves within space and improve their balance. And there's always options in addition to considering hearing aids or an implant and improving their hearing to consider various therapies like balance therapy, hearing therapy, whatever way that we can ultimately support that hearing and balance mechanism to improve things for the user, for the patient. The other option is that ultimately they can there are hearing aids or hearing devices or other types of devices that are, let's say, listed on Senior Living that can potentially detect when a patient falls, right? So the hearing aids, in hearing aids, there's actually this this tool that if the patient falls due to whatever it may be, their hearing loss, or they stumbled, or due to their inability to maintain posture, they get a notification and their family members get a notification that they've fallen. And so that also helps to reduce a lot of the side effects and the sequela that happen when patients do fall.
So a hearing aid can potentially decrease the risk of falling and can also increase the care needed in case of a fall after the fact.
There are some devices that are that sophisticated at this point where, yes, they're going to improve their hearing and also detect if the patient is at risk for a fall or has fallen and notify family members.
We've discussed the advantages of hearing aids before and how they don't just help hearing, but I find it fascinating that it can prevent a life-changing incident such as a broken hip that may take a senior out of their home and put them in assisted living because they can't care for themselves anymore. So it's interesting to think that a hearing aid can make such a difference in someone's life.
I would agree. And actually in New York, the falls prevention team is offering hearing screenings to the elderly population or to older seniors just to make sure that we're covering all the bases to reduce the risk of falls for this population. Because like you said, that risk, it just leads to very difficult or challenging side effects like a broken hip or damaged knee or whatever it may be.
We really appreciate you taking the time, doctor. Thank you so much.
My pleasure. It's a very dynamic topic, and I enjoy speaking to it. And it's very interesting how they correlate and how improving the hearing can ultimately improve the balance and reduce their risk.